and going live on Facebook. All right. All right. So thank you everybody for joining us for another wonderful town hall with Northern Virginia Family Services on COVID-19 safety and vaccinations. We have the amazing Dr. Jason Singh with Kaiser Permanente Mid-Atlantic Group, correct? And he will be talking with us about returning back to the workforce during this ongoing pandemic. Just a reminder that we once again we appreciate everyone joining and being part of the discussion. This is being recorded and will be accessible on our website and on our Facebook page. So you can always share this amazing webinar and town hall with your friends and family and on your page and groups. So just a heads up, we are Northern Virginia Family Service, and we are partnering with Kaiser Permanente to remove the fear and anxiety from our communities regarding COVID-19. We help remove rumors and misinformation, create content, and share this information on Facebook and Instagram while creating town halls to share live, such as this one. So also we'll be having a question and answer afterwards, and we will be asking viewers to engage in a poll after at the end of this webinar, just to see that to find out if you learned anything new. All right, so I'm going to turn over to our amazing Dr. Jason Singh to introduce himself. Take it away, sir.
Sure. Thanks, Janae. Thanks for having me on. Hi, everyone. Looking forward to this evening and really just engaging with you all here with Northern Virginia Family Service. I got to say, it's really amazing what you all do, first of all, and the impact that you guys have on individuals and our communities. Incredible, truly remarkable. So I'm really grateful to be partnering with you this evening. Just a little introduction about myself. I'm Dr. Jason Singh. I've been with the Mid-Atlantic Permanente Medical Group for about 6 years now. I'm a primary care physician, board certified. My practice is here in Manassas, but I also oversee both physicians and facility operations in our Haymarket and Fair Oaks locations in a leadership capacity. So my understanding for this evening is, as Janae, you mentioned, it's a sort of a Q&A sort of overview of the pandemic, COVID-19. Hopefully I can demystify some of the information out there. Hope to touch on the flu season that's coming up. I know that's important. And then just really any other information that you need from me to help ensure a safe transition back into in-person environment. As you all probably know, data is constantly evolving, so guidelines do change in response to new results. So I will present the latest evidence-based information. Some topics or some answers may be a little bit more on the gray area where we just don't have enough data, and I will make sure to point that out specifically and make a note to follow up on it. But awesome. Looking forward to the discussion.
Thank you so much, Dr. Jason Singh. So, Doctor, you've been on the front line. Can you tell us about what you have been seeing during this pandemic? What have you witnessed and how has it affected your patients?
Yeah, good question. Good starting question, actually. The words that come to mind are, I want to say, stressful, challenging, but also rewarding. I've worked on the front line. I continue to do so. I'm in my scrubs as we speak here. I have diagnosed and treated COVID patients of various severity, guided families through quarantining, I've also guided our staff in developing workflows to disseminate information to our patients. We learned during this pandemic that information rapidly changes. So it's really important for us to be consistent with our messaging and follow an evidence-based guideline that is compatible with national guidelines, right? I want to say also, this pandemic has also reinforced how important access to care is, right? And that's one thing I'm incredibly proud of our organization. Kaiser Permanente has always been in the position to provide like this robust telemedicine care delivery, where we just make care easy, accessible, and just convenient for folks, right? This pandemic really allowed us to enhance those features. Our patients are now able to access tons of information on the pandemic and COVID-19 through our kp.org portal. It's interactive. And we can customize it, right? If you have any specific questions, those messages can come right to your doctor. If you've been exposed or a family member sick, COVID testing, treatment, vaccine, what we've learned also from the pandemic is we can even set up drive-through testing, right? To minimize your exposure of coming into the building. We offer swab testing, blood draws, vaccinations. We learned also in the pandemic that we can provide virtual care support. This is essentially a 24/7 wraparound care that a doctor can check in with you almost daily or weekly. And I was doing a lot of those as well, where I would check in with patients that were diagnosed with COVID-19 and were essentially quarantined. They're isolated in their room and I'm their only form of contact. So it was really nice to have that relationship with them, but also sort of guide them towards their treatment process. And it was really great to see our pharmacies being able to now just mail delivery prescriptions. That was another sort of pivot point for us where we can minimize folks having to come in. Let's just mail the prescription directly to your doorstep in 2 to 3 days and don't even worry about the cost of delivery. We'll cover for it. So there is no cost in getting that done. So many elements of a system were designed to just allow access to care, which I think, your organization does a really great job of, is providing that sort of wraparound service. So to essentially balance those disparities. So, to summarize, I've been taking care of patients firsthand and really proud to see how we've taken that leadership role to stay ahead of this in both from a state and a national level to really just give that blueprint for other care deliveries to follow in the community.
Right. Thank you. Appreciate that. So we're already getting some amazing questions. And so just to touch, to piggyback on a little bit on the topic we're talking about now, how many breakthrough infections have you seen?
So breakthrough infections is rare. It's actually it's minimal. When we talk about breakthrough infections, we're talking about folks that have been vaccinated and or those that had previously gotten COVID. Breakthrough infection not only rare, but when they do happen, they are usually mild to moderate symptoms. So pretty minimal.
Thank you. You know what? Thank you so much for the definition for breakthrough. I'm pretty sure, people see those, those phrasing on TV and in articles, and they're like, what does that even mean? So I appreciate that, that little bit of definition and backup story for it, I guess. Thank you. Mm-hmm. And so since we know that you were with Kaiser, has Kaiser required all staff to be vaccinated, and how has the workforce responded to it?
Yeah, I mean, I think it's important for us to get vaccinated because we know vaccine is one part to ending the pandemic. It's the most critical part, right? We know by numerous independent studies that vaccines are effective in protecting you. But more importantly, it minimizes risk of serious illness and hospitalization. And I think that's why it's so important for us to get the word out in the communities. And so our stance is always to highly encourage widespread vaccination to limit the spread and really restrict the virus's opportunity to mutate into new variants, which we're seeing now. Absolutely. So we certainly stand by making sure that occurs and promote that widely.
Understood. So we already touched on a couple of points that I really wanted to talk about. So why people should get vaccinated, and people that are getting vaccinated are apparently getting COVID, right? And those are those breakthrough infections.
I
So
was going to say, just to follow up on
yeah,
that,
please do. Yeah.
with getting vaccinated and COVID-19, it's
Hmm.
important to recognize that you can still get the virus, right? But what it
Right.
does is it minimizes the symptoms, if at all,
Mhm.
right? Think of it like a
Yeah.
seatbelt, right? When you're driving your car, you have your seatbelt on. It doesn't necessarily protect you from a car accident. What it does is protects you from
True.
getting severely injured from it,
Yeah.
right? So likely no symptoms, or you'll have lesser than if you were to have gotten COVID without being vaccinated. That's kind of how I sort of explain it to some of my patients.
That is a great. That's a great analogy. We've been getting some really amazing analogies from our Kaiser doctors, and I really have to start documenting them and putting them on bumper stickers because they are golden. So thank you for that. Uh, Also, we talked a little bit. We mentioned that we were going to talk about COVID-19 and the flu, right? So some people always equate COVID-19 to the flu. Can you tell me really what is the difference between COVID-19 and the flu? And we really should be concerned about both of them, right?
Yeah, Janae, I'm so glad we're talking about the flu as well, because the flu season's coming up.
It
Uh,
is.
one one thing I will say we've learned during this whole pandemic is, using precautions like masking and increased hand washing and social distancing. Not only does it help minimize the transmission of COVID-19, but we realized this also kept the common cold, including the flu, at bay. And this was consistent with what the CDC reported this past flu season, which was relatively low rates of flu cases. So now that restrictions have eased and we're transitioning back to in-person interactions at school and work, we're anticipating colds and flu cases to rise again. And I think it's also important to mention here that immune systems aren't as robust, having isolated this past year without our usual exposure to common bacteria and
Mm,
viruses. So that natural
good
immunity to
point.
the flu is just not there this year, right? And
Right.
so because of all of this, we're really getting the word out about the flu as well. We don't want COVID to completely overshadow the flu, and that's why the best way to prepare is to get your flu shot this year. And just to be clear, flu and COVID-19 are two separate viruses. You can potentially get infected with both.
Oh,
And that's why, and then also it's important to recognize vaccine from one virus does not necessarily give you protection to the other virus. So that's why it's recommended
yeah.
to get, in addition to your COVID vaccine, to get your flu vaccine. And that's something we've made it really easy for folks. Where at any one of our Kaiser Permanente locations, folks can just come on into our flu clinics or even to our drive-through for easy access and get that done.
That's very convenient. That is probably faster than going to McDonald's and getting like a large French fry, I'm sure. So I appreciate giving us that heads up on where people can get their flu shot. So they can just go on the website and find out where the drive-through clinics are to get the flu
Absolutely.
shot. All right,
They can
perfect.
go on the website, or they can walk in at any one of our sites, and
Perfect.
we'll be able to get them their shot.
Awesome. And we'll be sure to share that information in our follow-ups. Oh, do they have to be a Kaiser Permanente member to get the flu shot?
Yes, they
They
do.
do. Okay. So there. Thank you. That was a question from the audience. So let's keep it moving. This is already an amazing conversation. So, what are some secondary issues that are come from being exposed to COVID-19?
Yeah, it's a good question. So if you recovered from COVID-19 and you're still experiencing some symptoms, you could have what we call post-COVID condition.
Mm,
Our understanding of the duration or how long this condition lasts is still not completely clear. It's been described as lasting 3 months. Some have described it as long as 6 months or even up to 9 months. But
wow.
as you know, we're still a year and a half or 2 years into the pandemic. So there's still more studies that need to be done to follow patients who've developed post COVID-19. My advice has always been to patients that if you are having prolonged symptoms from COVID-19, to just come in and seek care. I really like our medical group's approach to using care pathways. This is essentially multidisciplinary. It includes our primary care physicians, relevant specialists, psychosocial workers, even mental health professionals, right? Because if you've had symptoms for so long, it can be quite debilitating for a lot of folks. And so I think the first step is to go ahead and schedule a appointment with your PCP so we can evaluate that and also assess for any other secondary causes that may be going on. So this may require some blood work or even potential imaging.
Right. That is great advice. Thank you so much. And, as you know, of course, as we're on Facebook, we're on Instagram, and we see that there's just a wide variety of misinformation and disinformation and just some really wild rumors going on right now about COVID-19 and the vaccinations. Can you just touch on some of the ones that you think are really vital for us to, dispel, and just, whatever you think is very is priority?
In my practice, I'd say most of the opportunities to clarify is around vaccine safety. I think it's important to recognize that COVID-19 demanded a unprecedented vaccine pipeline. A lot more scientists and resources were put into the approval process right away, right? The FDA set standards for vaccines to meet before they were approved, which includes 4 phases, and how many volunteers received the vaccine at each stage before it could advance. And so we had a record number of volunteers. And because this virus acts fast, right, and is contagious, that actually works in our favor because we can get data very quickly and results really fast. And so what allowed us to move forward with the vaccine so quickly is, one, the record number of volunteers, the record number of scientists and resources put into the trials to research this, and the fact that the virus infected so many people that we got turnaround on results so quickly. So the data and the manufacturing of the vaccine was not any different than anything else. That was still the same process and timeline, but the availability of resources for evaluating it made the whole process really efficient. So that's why it came out in such lightning speed, which is really amazing. And of course, the results of all those trials showed that the vaccines are safe. They do not carry the live virus, meaning you can't catch COVID-19 from the vaccine. But more importantly, each vaccine showed about 95% efficacy at preventing moderate to severe symptoms of COVID-19. So the benefits significantly outweighed the small minimal risk that came with it.
Understood. Thank you for that. So let's talk about getting back to work, right? So how can we protect ourselves as we head back to work? Is it safe to share an office or a cubicle with someone?
Yeah, that's a good question. And it's a question that's coming up a lot, right? Because of the loosening of restrictions and, with schools and work reopening. The best way to protect ourselves is quite honestly to be vaccinated, right? Not just against the COVID, but also flu, right? Flu also travels pretty fast and can really be debilitating in an office space. And so also using precautions like masking, increased hand washing, social distancing. The CDC has a really nice guideline for businesses on just identifying exposure and contact tracing and terminal cleaning. So I find that really helpful, and I always encourage employers to take a look at that. As far as, another question that I always get is, should we be masked, right, when we're back in the office? I will say the CDC recommends if you are not fully vaccinated and working in indoor places with people that are also unvaccinated, then wearing a mask will help reduce the risk of spreading.
Sounds good. Thank you so much for that. So I think you kind of touched on this, but an audience member was asking, should we be worried about the possibility of breakthrough infections for those that are vaccinated as we mingle with coworkers? But we've kind of touched on it. Can you just talk about that for a couple of seconds real quick?
Yeah, it's a really good question. I will say if you were to get a breakthrough infection, right? The symptoms are going to be mild, like a cold, and a lot of folks won't even notice it, right? It's going to be a small cough or runny nose. You don't think twice about it. And so that is a potential to go up. The fact that you're vaccinated or had previously had COVID, that should help in your favor.
Sounds good. Okay. And so Northern Virginia Family Service and a lot of our other counterpart organizations tend to go to client homes. Is it safe for people to go to homes of clients right now at this time, or should we stick with trying to do things virtually?
Yeah, that's a good question. I think this also goes back to evaluating what the environment is, right? If the home you're going into is also vaccinated, right, and you're vaccinated and you're both wearing masks, we know the risk is very minimal. When you come out to wash your hands, that's very important as well. And so I know some companies have set up virtual opportunities to maintain productivity. And so I think you have to find what best works for you. But I can tell you what is the best evidence is being vaccinated and wearing a mask. That's really going to be the key there.
Boom. You're right. I love it. And so you touched on this too. What are some of the things that we need to think about as we protect staff? And masking, of course. If you feel that there might be some potential for exposure and getting vaccinated, hand washing. Should people still keep large, because we saw the huge influx of hand sanitizer. Is that still something that is a beneficial use to the workforce and even at home, or should we just really just wash our hands?
Yeah, right. That's a good question. If you don't have access to, to be able to wash your hands with soap and water, that's by far the best, by the way. If you don't have access to that, of course, hand sanitizer does help. It does minimize the transmission as well. So if I were to rank them, I would say hand wash, soap and water, then boom, next is hand sanitizer right after that.
Sounds good. Thank you. I completely agree. And how can we protect people who have health conditions that prevent them from being vaccinated?
So let me make sure I understand that question. How do we prevent those that have health conditions from, say that again, from being vaccinated?
From being exposed that have not been able to get vaccinated and might have underlying health conditions that might delay them from getting vaccinated or even being vaccinated altogether.
Yeah. Okay. Yeah, and that's a really good question, because what we learned is, there's very few contraindications to getting the vaccine. And get the vaccine. There's very few contraindications, and those are listed on the CDC as well. So between now and vaccination, the best thing to do again will be to maintain social distancing when you can, and to mask. That's really the two major things. And then of course washing your hands. So I know we sort of touched on a lot of these sort of methods, but they work really well. So and the part on chronic conditions, I think that's also important to look at as well, right? To make sure if you do have chronic conditions that it's well optimized, right? If you are someone with really bad COPD or asthma or congestive heart failure, that you're medically optimized, that your blood pressure is well controlled, and you want to be in the best health and shape of your life, right? And so I think that's one opportunity I would tell patients, to just be in touch with their primary care doctor and make sure they're doing all the preventive things to stay healthy and getting their lab work done, eating healthy, exercising right. The more you optimize your health, lesser the chance of having complications from COVID-19.
Right. Understood. So, I would love to talk about what the workforce is you're starting to see people in workplaces requiring vaccinations or proof of a negative, COVID test. And President Biden just announced that federal workers will be required to get vaccinated. And so, is our job allowed to ask for proof of vaccination?
Yeah, it's a good question. And this is something I may direct folks to the CDC website because they
Right.
actually have a statement on this. It's interesting,
Okay.
that if it's a required practice, can ask for it as long as medical information is not part of the proof, is what it states. To your point, you're right. We're seeing an increasing number of jobs asking for proof of vaccination, and the question is, will that be the trend? I think so, right? Because it's such a public health concern right now, and employers want to keep their employees safe. And so one thing that we've done is in our kp.org app, we made it really easy to access your digital proof of vaccination that you can just show and pull up and for public places or even the airport where that may be required to show. So I do see a trend going in that direction.
Mm-hmm. All right, thank you. I appreciate that. Especially directing our audience to the CDC website to get clarity on that. Thank you for so much. So, let's see what other. Oh, we have a good question here. We've been overusing hand sanitizer for 18 months. Should we be concerned about superbugs because of all the sterilization?
Yeah, that's a very good question. You have to look at it, the benefits versus the risks, right? With hand sanitizer, because we're in a pandemic, the hand sanitizer use still outweighs the benefit still outweighs the risk. So I would still recommend using a hand sanitizer and using some kind of disinfectant to do terminal cleaning, particularly if folks have been exposed or COVID-19 positive. So I think there is a place to use that, particularly this time right now.
Understood. Thank you so much. And oh gosh, we've touched on most of our amazing talking points, so thank you. And let's see, we have here we go. This session has the most questions in all of our town halls. So thank you.
Great, that's awesome.
Yeah, it's a good sign. If you do get COVID, when do you stop being infectious?
Good question. So we know once we're exposed to COVID, it takes about 3 to 4 days for you to show symptoms. And so the moment you're exposed to its cycle, which is usually around 10 to 14 days, you are contagious. And so you can give it to someone else. We've also learned is by day 14, if you're still having any kind of respiratory symptoms, like you're coughing a lot, that we can expand to 21 days sometimes. You can be contagious up till then. But majority of the folks, from exposure to about 10 to 14 days, you are contagious.
Good to know. Yeah, that is a long period of time. And I'm guessing even if the symptoms aren't as prevalent, you can still be exposing people to COVID for almost 14 days.
That's right. And that's why it's incredibly important to be vigilant on your symptoms and identify and quarantine as soon as you can to minimize the spread of it to other folks in the household.
Right. And when you say quarantine, do you mean, so are people allowed to go to the grocery store, or should they just stay home?
Ideally, you want to stay home. If you're COVID-19 positive, ideally you want to stay home, right? And monitor your symptoms. The reason to sort of leave would be to seek further care, right? If your conditions are worsening, but ideally you want to stay home.
Understood. All right, so audience, don't go to the grocery store. Stay home. Okay, just don't do it. Thank you. We're doing really good on time, so this is great. Can we talk about the Delta and Lambda variants and the other variants that are coming up? Because as one of my girlfriends said, she's like, we're seeing the entire Greek alphabet coming up. And as someone that's in a sorority, it's kind of, I'm like, please don't get the Zeta. Just don't do it. Just stay where you are. But can you touch on some of the variants for us, please?
Absolutely. So let's talk about variants. So when a virus is widely circulating in population and causing many infections, the likelihood of the virus mutating increases. The more opportunities a virus has to spread, the more it replicates, right? And the more opportunities it has to undergo changes. And that's how you get variants. In the US, the Delta variant is now the most common COVID-19 variant. It's more contagious than the earlier variants, and it may cause more severe illness. But what is reassuring, though, from our research is vaccines still appear to provide some protection against severe forms of it. And so less ER visits and less hospitalizations. We are closely monitoring the Lambda variant that is found in some of the other countries. I think it's a little more prevalent in some of the South American and South African countries. And we're closely just monitoring to see with our national research if there is any further guidance from the CDC and the WHO, the World Health Organization, on how effective our vaccine is against the Lambda variant. But it hasn't really been as prevalent as the Delta variant here in the United States.
I heard there's, well, one of our audience members says that Mu is in Florida. So apparently we are really moving our way through the alphabet. That's painful. Oh, man.
Yeah, I think it's important to recognize that, you know, when a virus becomes a variant, right? Variants don't necessarily mean the next variant is more severe or more pathogenic, right? You can even get weaker variants as well. And so that's why it's important to understand which variant's out there and then how severe it is. And so with Delta right now, that's the one where sort of all eyes are on right now.
Understood. So do you know what, I know this is not really part of our speaking points, but do you know how we're going through in naming the variants, or are we actually just going through the Greek alphabet?
Yeah, it's exactly. It's a system. You got to go a systematic format, right? And so that's just as a new variant is discovered, it goes to the next Greek alphabet.
Okay, understood. Thank you.
Yeah.
So here's another audience member question. As we get to the flu season and you have breathing issues as a symptom, should you request to be tested for COVID also?
That's a good question. You know, I wouldn't be surprised. We do. And actually, our swabs can test for flu, COVID, and RSV. So we can test for all three with one swab. And so we are actually anticipating that, right? Because that's actually a really good question, because a lot of the symptoms for the flu overlaps with COVID. And so we may not know until we get it tested. So when you do come into one of our drive-thrus or get a self-test done, we have a home kit that we send out to our patients. The one swab can test for all those things for you.
Okay. So I've been tested for COVID, and the test I had it felt like someone put the entire swab down into my esophagus. Does it still go that far down, even with testing for RSV and the flu and COVID?
Yeah, good question again. No, so the swabs now, and that's for the PCR as well. The testing is not as uncomfortable, right? It's still in the nares, right? But it is not as previously when we were swabbing as uncomfortable for our patients.
That's good to know, because I know people that have been scared to get tested because of the discomfort. So it's good to know it's not as invasive anymore. Here's another good question. Which test is better, swab or spit?
Swab, because the virus
Awesome.
is in your respiratory droplets. That's where you're more
Mm,
likely to see it. So always do the swab first, PCR testing.
good to know. Thank you. This is like the greatest Q&A that we've had in ever.
Well, good.
So so we have another question. If I go to my workplace that is not requiring staff to be vaccinated, oh wait, I think we touched on this. How do we protect family when we go home? And that's just, what do you suggest?
Yeah, so obviously, if you're vaccinated, the risk is significantly lower. You
Right.
combine that with washing hands and wearing a mask when you're coughing, then the rate of transmission significantly drops. What are some ways we can protect our family? We talked about the social distancing and
Yeah.
avoiding crowded areas during surges is another one.
Right.
One thing, this is really unique to Kaiser Permanente. We have a COVID household prevention program.
Ooh,
The program
okay.
provides counseling to patients who are diagnosed with COVID and on contact precautions they should take. And
Right.
they're given a quarantine kit to help prevent the spread of the virus to others in their household, the
Mm,
community, and the workplace. So that is a very common question that comes up. And I'm glad we have sort of a action plan for that as well.
right. So what exactly is in the kit? This sounds amazing. When I think of a kit, I think of maybe there's popcorn in it, some hot chocolate. I'm sure that's not what's in the kit.
That would be
But
nice, right? That would be
yeah,
nice. Everything in a quarantine kit is really around keeping yourself safe, right? With wear masks, wiping things down, and if you have symptoms, then having a pulse oximeter to check your oxygenation level.
okay.
And we
Good.
also have information for folks to read just around the nature of exposure and COVID infection. So there's a lot of information that we send out. And then, if you do have like mild to moderate illness, we can even
Mhm.
set up a sort of a virtual visit with you, just a nice little video visit for you to just touch base with a physician, just to check in to see how you're doing and ascertain any questions that you have.
Right. Okay. And another question, how often should people change or wash their masks? Um, my son, he has a favorite mask that he just loves to wear, and I have to sneak it away from him. And sometimes what a teacher once said to me, "It's okay if he wears it again the next day," and I'm like, I don't know. So should my son and all these other first graders, are they allowed to wear their mask a second day?
That's a good question. And this is one of those gray areas where there's not enough evidence, right, for me to
Right.
tell you how often to change it, right? We know with certain masks that the CDC recommends that are like recommended for the pandemic, you can use for a couple of days and then switch it out. So
Right.
I think it's going to be mask dependent. I have two young kids, and they definitely mess up their mask, and we tend to
Yeah.
change it every couple of days as well. But as far as like actual days to give guidance on, I don't have that. And I would, that's something I would probably defer to the CDC to see if one of those masks are listed in the CDC, and then
Mhm.
their guidelines on how one should handle that.
Right. So, I know this is not a question on our list, but I mean, some masks are just not allowed, right? So the ones with like the ventilator, why don't they allow? Like I went to the museum and they said no, you can't bring the ventilator mask in. So I just threw all of them away because they were. I saw a trend of it. What is the reasoning behind not having the mask with the ventilators?
I think it's just insufficient data, to be open with you.
Right.
We just have more or better data on some of the other vaccines like N95s, surgical
Right.
masks that have
Yeah.
shown benefits. So we just don't have enough data on, the thousand different masks and variations of masks that are
Yeah.
out there. And
Right.
so it's more sort of sticking towards the ones that we have evidence-based information on.
Makes sense. Thank you for that. And since we're coming up on our time and we've had some really just great Q&A and some just awesome information. I appreciate it. This has been just a very educational town hall. So the question everyone asks, people still ask this: which vaccines should they get?
Great question, and I have an easy answer for that. It's really the one that is available. To be completely open with you, whichever one you have available. So there's on the market. There's Pfizer, Moderna, Johnson and Johnson. At Kaiser Permanente, we have stocks of vaccines that we can easily get to you if you are interested. We have supplies at every one of our sites. You can easily drop in or just do one of those drive-throughs to get that done. Just important to know that the Moderna and the Pfizer vaccine is a 2-dose series, whereas Johnson & Johnson's a 1-dose.
Right, perfect. And we know that people are now getting boosters. Who's getting what population is getting booster shots right now?
Yeah, it's the population that are immunocompromised.
Okay.
Because we know that with the vaccine, the immunity starts to wane if you have a suboptimal immune system. And so that's the population that's getting their booster vaccination.
Very good. All right. So just a big thank you to you, Dr. Singh. Is just going to check in with our audience. Is there any more questions here on Zoom or on Facebook Live? Please let us know in the chat and in comments. We appreciate everything. So we appreciate this amazing discussion so far. And thank you for letting us know where people can get vaccinated. They can also go to vaccinate.virginia.gov or call 877-VAX-NVA. And there's a Spanish option to dial in, and you can find out where to get vaccinated through that. Do you have any last thoughts or advice for our audience?
Sure. Janae, first of all, thanks for having me on. Very good questions and very important questions. I understand getting the right answer from reliable sources can add to your peace of mind, right? And so I encourage everyone to just talk to your doctor, learn all that you can about COVID-19, safety protocols, the vaccine, so you can make the best informed decision for you. But again, thank you for having me on. I look forward to partnering on more healthcare topics. And if there's no questions, you guys have a wonderful evening.
Awesome. Thank you so much. And before we go, I'm going to start the poll so people can just go ahead and answer it real quick. I would appreciate it. And next month, we will be having Dr. Jason Singh on again to talk about the flu season. And then we will end in our wonderful program will end in November. And we'll be talking about what is next. So please take a look at our website, nvfs.org, to see the rest of our upcoming webinars and register and follow us. And if you want more information regarding the pandemic and hearing about the great information that is coming through the pipeline through Kaiser and the other works we're receiving from our partners, please feel free to email me at jpadmore, PADMORE, @nvfs.org, and I will subscribe you to our newsletter, and you can receive that weekly. And that is it. So again, thank you, Dr. Singh. We appreciate the information you've given us, and we look forward to seeing you next month.
Sounds great. See you guys soon. Have a good one. Be safe.
Thank you. You too.